That may get you high for 6 to 8 hours. What happens with heroin, you can buy a thing of heroin for 48 bucks and get several hits out of that. So what happens is people get addicted to the heroin pain pill, opioid-based pain pills, and they no longer can afford $100 per pill. One thing that Chelsea said, never in a million years would I ever think that I would stick a needle in my arm. But her addiction got so bad from pills, she couldn't afford to buy the pills anymore, and it was cheaper for her to switch over to heroin. Okay? Also in the beginning, did you hear where Chelsea said at 15 I started out smoking marijuana and drinking? So now we make the connection again. It doesn't mean that everybody who smokes marijuana is going to wind up with a heroin addiction. But again, that's why we refer to it as a gateway drug. Okay? There comes a point when you all remember if you smoked that first cigarette, man, you coughed and hacked, and the more you smoked, your body built up a tolerance to it. To some people, my mom and my dad were 2 and 3 pack a day smokers. My mom started when she was 13. So what happens when it's an addiction, when that gets into your body craves it. Your mind craves those drugs. And so you can no longer have one pill. Now you have to have 2. Then you go from the pills, then you got to start shooting up. So I'm going to ask each of the panelists, if you guys don't mind, to introduce yourself, and then we're going to take some questions if you all have any questions. So we'll start right here again, Chief.
Ray Mossman, Chief of Police in Kenova.
I'm Brendan Willis. I'm an officer here in Kenova.
I'm Kim Miller. I'm the Director of Corporate Development at Prestera Center.
I'm Charity Dameron, and I'm the Director of the Wayne County Family Resource Network.
You may have saw Kim in the video.
Which I'm not proud of. It's hard to watch yourself over and over.
Chief, I'm going to start with you guys, if you don't mind. What are you all seeing in this particular area of your town and our state as it relates to marijuana and heroin?
We're seeing a lot of heroin in traffic stops, just probably 75% of our traffic stops late at night especially involve some sort of drug, alcohol, marijuana, and heroin.
You mentioned to me something's happened in the last few months.
Yeah, well, here in the community, since I've been here, I think we've had 4 overdoses involving heroin. So it's prevalent in this community, big time.
How many of you all were aware of that live here? Did you know that you already had 4 overdoses?
Since August.
We've also had traffic stops with large amounts of marijuana. We've had several arrests involving marijuana, also prescription pills. One incident, we arrested a male, and he had 102 controlled pills on him that he did not have a prescription for. There was just an arrest a couple of days ago where someone had, I believe, 10 Xanax. The one where the male had the 102, he had hydrocodones, he had 3 different types of Xanax. So it's pills are still prevalent. It's more heroin, marijuana in through here more often than not.
Any questions you all have for the panelists?
You all had an arrest the other day that you found drugs, but you also found stolen items. And those sort of seem to go hand in hand.
Typically, when people develop a problem with, the drug usage, they have to find a way to make the money for it. A lot of the times people will break into vehicles, houses, things of that nature, so they can either find pills or they'll find merchandise that they can go and pawn or sell on the street so they can get the money to buy their drug of choice.
They're not breaking into your house and stealing your TV so they can go home and watch Jerry Springer. One of the things that we're also finding out is when they break into your car, they're looking for change. If they steal something from you, they have to convert that to cash. So you got to pawn it or find someone to buy it. But if you've got change in your console, if you've got money laying around there, think about that. You got $4 or $5, they break into 10 cars that have that kind of money. They don't have to convert it. That's their money that they need. So, again, be very, very careful what you allow someone to see through a car window that may be, again, in your car, especially this time of year, okay, into the holidays. Kim, what, in the area of treatment and recovery, as far as marijuana and heroin?
Well, there's a lot that I could say, but I'll try to keep it brief. Crestera Center is in the business of helping people achieve their full potential. That's what we do. We know beyond the shadow of a doubt that even though there's criminal aspects and criminal situations, and those have to be dealt with, and there are laws that deal with those, and people need to suffer consequences of their actions, absolutely, or they just don't learn. And so law enforcement has a role, but also treatment has a role. Because people that come out of jail don't necessarily have the rehabilitation skills that they need to be successful in life and not go back to using drugs again. So we provide those treatment services. We provide basically mental health or mental wellness services. We have primary care services at our Route 60 location, and we have a variety of drug and alcohol treatment programs. And we have a larger continuum of treatment services at Crestera Center than any other center in West Virginia. We employ 900 people. I don't think people know how big we are and what we do. We're in 53 locations across 8 counties. So we've got something for everybody. And people will say, if they're addicted, they'll say, oh, they're not gonna take me, or I can't get in there, or that's too much work. But your job as a loved one is to press them. I brought some brochures and some information. I put it on the table. I also got some pens. So the first, 10 or 15 people that get over there can get a pen with our phone number on it. Help is a phone call away or a walk-in visit away. We see new people Monday through Friday between 8 and 9 a.m. If you don't make it there before 9, come anyway. Bring proof. If you have insurance, bring that. Bring proof of who you are, so we can get you registered correctly, and we will help you starting immediately. So there's no need to wait. If what you need is a bed, or a person that needs a bed, we have beds open. Every day there's beds open. But people who need help may not be perfectly motivated yet, but we specialize in helping people get motivated. We work on engaging them. And there's a lot of new science now about what works in treatment, so we use the best, most effective, most modern techniques and interventions with folks to get them on the road to recovery. So it's not the case that you just go to detox to get the opiates or the heroin out of your system, for example. That's the beginning of your recovery journey. So you might need to go to a short-term residential program. You may need a long-term residential program. We have all of that. We have a program that we're kind of famous for. Has anybody here heard of Renaissance? All right, I love that. Renaissance is a long-term women and children's addictions recovery program. We take moms that have addiction problems and we help them turn their lives around. It's a very holistic program. We're dealing with every aspect of their life, their physical well-being, their emotional well-being, and their spiritual well-being. So it's more than just, treat the drug or take away the drugs and the person's fine. That usually doesn't happen. There's a long rehabilitation course. So the Renaissance program is an example of a 1-year-long program that is extremely effective. We put families back together. And so how do we solve this drug problem in our communities? One person at a time. The same way that you save the starfish that are washing up on the beach. One starfish at a time. So when you know that there's a problem or you suspect there's a problem, your responsibility is to talk to that person and say, I'm thinking you have a problem. Let's go get it checked out. That's the first step. And that's probably the hardest step, is to walk in the door. But when you offer your support and you help, people are much more likely to get help, the help that they need. And treatment works. It's effective. We just got to get more people there. We know that incarcerating them is effective if the problem needs punished. But you cannot punish a disease. An addiction is a disease. They have a brain disease. They've changed the way their brains work. Tim talked a little bit about that. So to change the way the brain works, to go back to a time before drug use, takes time in recovery, abstinence, and recovery skills. And you can only get that from treatment. Jails have a role, but jails don't heal people. And that's why you see people bonding out of jail and going back to the same crimes that they were committing before they went into jail. Because we haven't given them this recovery skills they need and give them enough clean time for their brains to resume normal functioning of the neurotransmitters that are critical to feeling okay.
I have a question?
But if,
Yeah.
go ahead again.
I just wanted to know how many people have died of prescription overdoses this year. Does anyone know? In West Virginia?
I can tell you that West Virginia leads the nation per capita. Now, I don't have an exact number for you, but I know that more people per capita, so adjusting for the population, California, New York certainly have more people living in those states. But West Virginia leads the nation when you adjust for the number of people in the state in drug overdoses. And it's prescription drug overdoses and heroin. And also methadone plays a factor. And there's, Prestera does not do any methadone, so don't send people to me saying, I need methadone, because we won't be able to do that. There's clinics that are government approved to do that. But those are the drugs that are.
And the follow-up to that question would be, how many people have died of marijuana overdose in West Virginia this year?
Right, 0. You can't
Okay.
really overdose on marijuana. I mean, there's
Okay.
some literature that says you'd have to smoke constantly every waking moment in order to really overload your system with THC. That
Okay.
doesn't mean that marijuana is not a harmful
Okay,
substance.
just wanted to know.
For all those reasons Tim talked about.
I've heard you mention Oxy and heroin, and heard the TV show something about Oxycontin. What about Opana? I mean, that's a new one, isn't it? And that's in there with it, right? How bad is that in West Virginia?
Anytime you are dealing with an opioid-based drug, which all of your pain pills are, you're gonna have that problem. I had a mother call me, he said, who's this Molly lady that all of our kids keep hanging out with? Molly is the powder form of ecstasy. But these kids were talking about, let's go see Molly. So the parent thought that there was some lady that's running town, meeting up with our kids. So part of it is education. I will tell you this, when it comes to some of the synthetic drugs, they've already got the next generation of this stuff out there. It's amazing to me. Have you all heard the new thing that kids are doing now? It's called smoking alcohol. They're mixing alcohol and dry ice that puts it in a vapor, and then they huff it out of the bottle. I mean, we sit back and we think, how in the world would people do those things? But when you have an addiction, and we've had people that have killed loved ones. If you saw in today's paper, in the state of Ohio, they're now reviewing veterinarian records because people are harming their pets to get tranquilizers for them. They would literally break a leg of a dog or a cat or injure their pet to go to the veterinarian to get the pain pills for their pet so they can take them. Now, again, we sit back and go, how can someone irrationally do that stuff? It's not rational, okay? We're constantly thinking about what would someone do, but when you are overcome and all you think about is that next eye, crime, police, people, doesn't matter. So when you're talking about, the new drugs, how they're doing it, the other thing is, where do most people get their information today? Off the internet, absolutely. There are blogs. Do you know that there's 94 Facebook pages dealing with some of the synthetic drugs? How many of your kids have Facebook? I mean, there are people now that are going on Facebook promoting how to get high and how to use some of these things. That's why what we're talking about, education. We need to know what's going on. Your child may not be doing drugs, but they certainly know who is. They know where to get them. They know what's going on. I learn more from the kids I work with and my own kids than I do any thing that I read, because they know what's going on. So sit down and talk to your kids, your grandkids, because these are the things that they're dealing with. Find out. Call Prestera, law enforcement. 4 of the biggest drug busts in Huntington happened because someone did an anonymous tip. I'm not sure, but this car keeps driving around the block. I walked up and right on the front door, it says the tip line. How many of you know what the tip line is? Okay? He can't arrest the problem out of your community. We can't treat all the problem. It's everybody working together to be able to do that. Education, it's key. It's important. Any other questions?
Well, along those lines, what kind of things do you look for? High traffic, people walking up and leaving quickly from my house, different cars there. I mean, what else stuff?
You got it.
What
That's
else
right.
stuff?
Anything suspicious, anything out of the ordinary.
You ought to know everybody in your neighborhood. You ought to know every car, people come and go. Normally, it's done after dark. Normally, you get high volume of traffic. You guys probably get a lot of Ohio and Kentucky plates here because of the boundary, okay? We see a lot of stuff, do the same thing in Huntington. It's being alert, working with them. Here's the thing, you call in a tip and it's nothing, no one's lost anything. But if your information leads them to a major investigation, then think about not only that person, but how many other people would have benefited. How many people died of heroin overdose since August here in this little town, in Kenova? Did someone suspect those people were having a drug problem? And it goes back to what Kim was saying. Are we also the enablers? Do we turn an eye on it, or do we excuse it? Do we not say anything? Those are the things I tell people. You're loving your kids to death. You're not loving them to life. What would you rather do? Go place flowers on a cemetery? Or would you rather go visit them in jail? Most people would I'd rather have them alive no matter what, and then get the help, be able to do that. But that's where we've got to be those eyes and ears, law enforcement. He could put another 100 officers out here on your streets, and that's not gonna fix the problem. It's all of us taking responsibility for that. Another comment? Do you have a question?
Yes, knowing everything that's, all the bad side effects of prescription drugs, and now knowing that marijuana is impossible to overdose on, then why is it not a safer alternative as for medications instead of things like Lortabs and all these opiate-based painkillers that West Virginians are overdosing on every day?
I used to work at Goodwill, and I taught the people that came in to me about drugs. When you smoke marijuana, it has 403 chemicals that come out of that smoke.
And so do our cigarettes. And
Cigarettes
alcohol
only has 43.
alcohol causes more brain damage than a lot of these
Cigarettes
medications.
only cause 43 when you light it up. Marijuana causes 403 chemicals.
I would like to see that study.
It's on a poster that's down there that I used to teach from.
I'll be sure to find it.
The marijuana issue is kind of a hot button issue right now. And the Silver-Haired Legislature in West Virginia, for the first time in the history of the Silver-Haired has one priority this year. And this is the Silver-Haired Legislature. These are people representing the AARP members, you know? And their only recommendation for this legislative session is legalize marijuana for recreational use or medicinal use or both, and tax the daylights out of it. That's their only recommendation. And to that I say, really?
But I'm speaking as a person with medical issues.
Sure.
I don't like the painkillers. I have a bleeding disorder. I had my wisdom teeth cut out, and I was laid up in bed rest for a month. It was really hard getting off of those prescription medications. I really don't like it. And I have pain every day. I would like to have a safer alternative than all
Right.
these
There's
prescription.
lots
Again,
of
we talked about,
There's
we
lots of
talked
pain.
about the synthetic. There are synthetic prescriptions
Those
that have the
synthetic
THC.
prescriptions have been proven not to be effective for patients across the country.
Could be, but until or unless it's actually fully legalized in West Virginia for whatever use, it will be illegal.
Sure,
So
I
the
understand
benefits
that.
of it are kind of moot as long as it's illegal. It's still
Why
illegal.
don't we try
That's
to educate people
right.
more about it, that it's not a killer like the prescription painkillers are?
But in turn, it would be just like alcohol is looked upon now. A lot of people, especially in rural communities and especially around in Wayne County, a lot of people don't think that it's a problem for your teenage kids to be drinking alcohol as long as they're at home or they're on a ridge or they're with someone that they think, as long as, and they're underage. But the fact is that it can lead them to the same problems that alcohol and cigarettes can do. There is studies and shown that's fact that marijuana is like smoking 7 cigarettes to one actual cigarette. So you're not only having the problems with your lungs ingesting the smoke, but it also leaves the opportunity for children to misuse this because they think that it's safe. And as we all know, that no drug is safe for any child to do, regardless whether it's legal or illegal. We have to be careful of what we give our children and the perception that our children perceive. So it's all about educating ourselves as well.
And where a lot of this starts at, I have a 12-year-old son. I know he's smoking. He's sneaking and smoking. I keep telling him, I'm going to catch you. And when I do, you're going to be sorry. And whoever sold it to you is going to be sorry. And you think that's just cigarettes. Except for he's taking money to buy that. And that person is taking the money and selling it to, or buying drugs with it.
It's a big thing in the elementary and middle schools now to sell cigarettes, like they sell joints.
Yeah.
Yes.
Wow.
$1
It's a big
cigarette.
deal.
you know? And I told him, I said, if I catch you selling it, if I catch you smoking it, I will wear you out. I said, you'll be eating those cigarettes. You
Well,
know?
if you do find out the store that is selling, please make sure that you contact Mr. Mossman here so he can contact us.
Let me go back again, dude. The issue is, I don't think, and I hope that I came across in the presentation, that there hasn't been longitudinal studies about the effect of it. Very small cases, less than a year. Some of these cases, only 13 people were involved in it. So I think as the medical community, I would much rather see, and when the 200,000 doctors across our nation, the AMA, come out and say, we're the doctors that treat pain. We're not seeing any benefit long-term with a lot of the people that we're working with. Yes, there are other synthetic stuff that we need to do, but just to say, yeah, we're going to pass it because we think it's a good thing, when the states, again, there's not that longitudinal quantitative study that shows us that there is any medical benefit to that whatsoever. So when those are able to be done, then we can go back and look at it. If we're going to, because we're going back to two things. Number one, are we going to approve it for medical use, or are we just going to approve it for a cash crop? And right now, the push is, let's just legalize it and make money off of it. That's a whole different ballgame than when we're talking about prescribing it from a doctor and then monitoring that particular person to do that. You have a question, ma'am?
My husband, years ago, we were big pot smokers. I'm not now. That's been 20 years ago. But I should have said that part now. But anyway, he was never, I was always a big cigarette smoker. He never smoked cigarettes. And he was a big drinker. But he will be 55 in February. Has horrible, horrible medical conditions now due to, and I have thought over the years, we always said, well, if we had our kids do one or the other, we would rather they smoked weed than drink alcohol because of the cirrhosis now. Like I said, he'll be in February, be 55. He's on oxygen 24/7. Everybody has their pros and cons. And I was just talking with her today about the marijuana, if, but the more you said and you think about and you hear things, like I never knew the chemicals that was in marijuana. I just thought it was weed that he smoked. I never knew there was that much chemicals in it. But for someone that never smoked cigarettes, and when he was younger he drank, and the cirrhosis and the COPD is horrible. He sits in a chair 20 hours a day now with oxygen at 54 years old and is totally just unproductive. I'm not saying that's all it costs, and I don't mean it that way, but and it took me till probably this meeting for that to register, to understand what it means by a gateway drug. We was never into anything else, but we were potheads back in our day. But I really just wonder if that was the initial of starting all of the issues, you know, and then when he was sick because of other things, he got on a prescription medication that didn't have no idea that you can get addicted to pain medication in a 6 weeks period. And then when you just take them from them and they withdraw, almost died because I wasn't aware that happened that quickly. But I know a lot of people think this may not be, but then that's all we ever did. I mean, we weren't dope heads per se as they classify people now. We were potheads. But the long term, I think it really is a long-term situation that can lead very badly. And we've had 60-year-old friends that have died from heroin overdoses in the last year that would never even, couldn't even tell you what heroin was like. But anyway, would have never known or dreamed that they were on heroin. So it's
And there is a real big difference between the Medical Marijuana Act that is going on and then the cash crop like Tim was talking about. The cash crop would be equivalent of walking into a convenience store and buying a 12-pack of beer. you know, and going to medical marijuana, which is regulated by a pharmacy and a doctor, that would be a different avenue to take because it would be more regulated. But when you're talking about just putting it out there for a cash crop, it would be no different than walking into a gas station and getting beer or going to a liquor store and getting liquor. And that is where the issue lies. If you are going, and to me personally, if you are going to use it for medical use, then it has to be regulated by the medical community. If you put it out there just as a cash crop, then we're going to have the same issues and the same problems that our county and our state face with alcohol. And to me, alcohol is no different than marijuana. Yes, it might be legal, but you can still go to any hospital in our state and around the nation, and every ER doctor will tell you they see just as many people coming in from DUI accidents or overdose from alcohol, cirrhosis of the liver, things like that, that alcohol plays a big, huge role to. So when we're talking about the medical marijuana and then the cash crop, it is totally two different things that is being offered. You know, West Virginia's looking at, they want the money, not the benefit that it's going to have to a person for their medical health. It's all about the tax. The whole
But again, the moment you make it legal, now you've got the same problem that we have with prescription drugs. We got more people in our state dying the non-medical use of prescription drugs, and it was prescribed by a doctor. And I'm certainly not against pain medication. If you need it, the doctor prescribes it, use it. It's when you begin to alter that. If the doctor says take one pill every 8 hours, you take one pill every 4 hours, now you're on the verge of creating an addiction. If you take 2 every 6 hours instead of 1, the moment you alter that subscription, that prescription, is the moment you begin to open up the opportunity for that now to be a problem. That pain pill helps me deal with my problem until it becomes my problem. I no longer have a hurt elbow, but now I've got an addiction to this pain pill.
But if you're on it for a long time, even if you take it every 8 hours, if you're on it for 6 months to a year or whatever, that's gonna cause an addiction.
You are
I mean,
absolutely
you don't
right.
have to take
You will
it.
be
That's right.
But it doesn't have to take 6 months to be addicted.
No.
No, it doesn't take that long.
The PDR says 30 days consecutively of taking an opiate, narcotic analgesic, 30 consecutive days exactly as prescribed, you will become physiologically dependent. Physiologically dependent means you're going to have withdrawal symptoms and you are going to be very sick. But I want to say thank you so much for sharing your story. It takes a tremendous amount of courage to share personal information, and that's how that kind of information is helpful to other people, to everybody, and I appreciate that.
Like, my husband was diagnosed with cirrhosis at 29. And so here in just the last year, it's been really bad, but like you're talking about the being addicted to the pills and stuff. He had to be put in a nursing home the beginning of this year. And just in a facility was overdosed and had caused a psychosis, and well, they could verify that, a drug-induced psychosis that I didn't know that it would do that. So he would call over here because he grew up here and would hallucinate and see people on the tracks. And so, I mean, a lot of people you don't have to intentionally, it's not that you intend to be an addict. Nobody wakes up and goes, okay, I'm going to be an addict. It doesn't happen that way, but thank God that I am nosy enough and big mouth enough to say, hey, what's happening? That my husband's not right. I know he's sickling, but this still isn't right. So it can happen so easily. And, you know, what you did 20 years ago, you know, God forgives you when you ask for forgiveness and you just try to go on from there and help, because it's easy, it so easily happens.
Yes, ma'am.
Okay, I have a couple things. First of all, the whole, I don't know about this marijuana thing, but I did smoke pot for like 10 years, and I'm only 30, so I started when I was like 15. Either way, neither here nor there. I haven't done it in 2 years, and I always thought there's no possible way you can get addicted to marijuana. It doesn't happen. And I'm not saying that I was addicted, but I could see at the end, whenever I did stop, that I may have had a dependency.
May have.
Because there was the anxiety, the excessive anxiety, the cravings. Even now, I still want to, but I don't, but I want to. So I can see that medically, I do think it's kind of both ways. I mean, there are benefits, not saying there aren't because I've experimented myself with it, but at the same time, I also was smart enough to know that, well, okay, marijuana smoke is a lot denser than regular cigarette smoke. Everything that goes through your body is filtered through your liver. It is very hard on your liver, just like with alcohol, Tylenol, anything else, it's very hard on your liver. My liver enzymes are always high. I was like, I don't drink, not a drinker. Why are your enzymes high? I don't know, but now once I found out that your liver filters it, I was like, oh, maybe that's why.
It's not just your liver, it's your kidneys.
Yeah, everything. That
You
affects
got
everything.
educated. You
Yeah.
educated yourself on,
Yeah.
and that's what we need people to do,
Yeah.
is to get more
He
educated.
found God.
And my dad, I mean, obviously, he was an alcoholic. I'm already predisposed to having an addictive gene. So to not do anything else other than pot, like, I knew I could easily become addicted. I could easily be an alcoholic. Obviously, I know that I had somewhat of a dependency. But anyway, I do see it both ways. But there are harder things that, we need to worry about. Secondly, just for you guys, you know how I keep up on things. So, I've been doing the homeless thing. And one of my people that I built a rapport with came, because me and him, we talked, and he did come and tell me that there are people actively selling the crocodile in Huntington within the radius of the homeless shelter, or the mission. So,
It's been found in Wayne County as well.
okay, so I just can't get to you guys quick enough. So,
It was on Facebook.
I know.
I
So,
get my bad.
I wanted to tell you guys, be on the lookout, because if it's a block down the road, then, it's gonna be here.
What is the, if you're taking drugs, even if it's some marijuana or whatever, how is that people get anxiety, the mental health issues that come along with it? That they may get off the drugs, but then they have anxiety, they have all kinds of problems after that, because it changes the chemicals in your body.
That's
Well-
why it's so important for them to go through recovery, so that they are able to get the tools that they need and the skills that they need to deal with the anxiety, the peer pressures, the stress, the nervousness, all of those self-medicating things that a lot of people do when they smoke marijuana or they take prescription drugs that are not prescribed to them. They're the same thing with any other drug user. But in order for them to be able to move on with their life and to succeed, they have to have those tools. They have to learn how to deal with things in their life that could be triggers for them to use drugs. And that's why it is so important that if you do have an addiction problem, that you do get some form of treatment or recovery, because that can provide you with the tools and the resources that you need to succeed in being a recovering addict.
We also refer to dual diagnosis. Someone is depressed, so they drink to feel better. Someone is grieving because they've lost someone. And I'm going to tell you right, this time of year, when we get into the holidays, it's very, very hard for some people, especially if they're lonely. So they look for those other things to kind of help them feel better. Part of that, again, Kim talked about the receptors in the brain. Well, it does make you feel better, but the one problem is now your body is starting to get used to that and wanting that. And so instead of dealing with the depression in a different way, it's covered up with alcohol, or it's covered up with a drug. And so, and charity, getting back to help people to understand the tools they need for those triggers. Sometimes it's a date. They lost a child, or a divorce, or a spouse on a particular date. And so that month or that week, they become very, very depressed. And so they're looking for those. Again, it's not something that I do because a doctor prescribed. It's my way of coping with the problem in the situation.
I have another question. Are you all gonna take this to the middle schools and the elementary schools and stuff?
With our, the Wayne Awareness Towards Cancer and Health, along with the Wayne Family Resource Network, what we do is we provide, with our substance abuse prevention grant, we do trainings for, we provide evidence-based programming to schools throughout Wayne County that provide educational resources and tools for kids ranging from kindergarten all the way up to 9th and 10th grade on tips on how to deal with peer pressure and to educate them on how to deal with daily stressors and tips and drugs, violence, and bullying.
I've communicated to sheriff that anytime they would like to host another one of these, that we want to talk about, meth or drug trends or what kids are doing, we're more than happy to come back down and facilitate that. I'm willing to come at no charge to your church, to your school, to your neighborhood, doesn't matter. I've spoken in front of 6 people and I've spoken in front of 600 people. For me, it's about getting the information out. And so Kim's got her information, I've got mine. So if there's anything we can do, even follow up. And we talked about, maybe in the early part of the spring, actually coming back and doing another town hall meeting. We knew that there was a lot of different things conflicting with tonight, and I'm very grateful that you all took time to come out tonight. And so we'll certainly look at doing some follow-up and reschedule, but we'll go anywhere we're invited.
I'd also like to invite everyone to attend. The Wayne Family Resource Network meets every 3rd Wednesday of the month at the Wayne Health Department at 10 o'clock. We are open meeting. Our Wayne Awareness Towards the Cancer and Health Coalition, they meet the first Tuesday of every month at 11:30 at the Wayne Health Department. If you or your church or your group would like to start an anti-drug coalition in the Kenova-Cerrito area, please feel free. Contact Ray. Ray's got all of my contact information. Myself, Tim, we will be more than glad to come and help you get a coalition started. There's tons and tons of things that you all can do as a community to help prevent substance abuse from happening. Number one thing, most importantly, is always talk to your kids because they listen. Talk to your grandkids, talk to your youth groups. Talk to them. They do listen. They might roll their eyes or they might bop around, but they are listening to you. Set good examples for your children. Make sure that, you have your liquor cabinet locked up. You have your prescription drugs locked up and out of sight. Also, if you are unable to make it to the prescription drug take-back days, we are working to get a permanent lockbox for Kenova. We have it ordered. We're just waiting on it to be delivered. We're also going to have one at the Wayne Police Department in the town of Wayne. But also there's things that you can do in your own home to dispose of unused, unwanted medication. If you've got a cat, throw it in the cat's litter when you're changing the litter box. Not very many people's going to go through your cat litter in your garbage to try to find a pill. Put it in ground up coffee grounds, your used coffee grounds. There's all kinds of things that you can do. If you have, leftover food and you throw out your scraps, put it down in your scraps. Don't ever flush it down the commode because we do live in a rural area where a lot of people still have septic systems and they still use wells, cisterns, things like that. And it has been proven that these prescription drugs can get into the waterways through going down septic systems or leaking out into the ground and can get back into the wells and into the cisterns. So we ask that you please properly dispose of them. And I know it's easy sometimes just take them in and flush them down the commode, but to be safe, it's always best to either put them in cat litter, your used coffee grounds. If you got a baby in your home, stick it in a dirty baby diaper. I mean, think things through before you just toss them in the garbage bottle and all. Always be aware of who is in your home. Don't think just because your grandkids or your grandkids' friends or your teenage kids have been coming to your house or your friends, they would never do nothing like that. It is very, very easy for teenagers and them to get into your medication and you not realize it until it's too late. So we ask that you please keep things locked up, out of sight. Be very careful when you go to pharmacies. Do not go in and ask the pharmacist, well, is my Lortabs ready? Or is my Xanax ready today? Because there's always people in that pharmacy that is looking and listening for easy targets. make sure that you don't tell your neighbors or your buddies, well, that doctor, he put me on Oxycontin, or he put me on 4 Xanaxes a day. Don't be open with your information about your medication, because that leaves you an open target for home invasion or someone to follow you, stalk you, and hurt you to get your prescription.
Any other questions? Yes, sir.
Just to, now, the Medical Marijuana Act, the West Virginia Medical Marijuana Act, that's strictly for medical and has nothing to do with recreational, is that correct?
Why are you you should talk to the
Oh.
legislator about that.
Oh, it is.
I'm
I
not
just wanted to
really
reiterate. I'm sorry.
sure What's going on.
Sure.
They haven't determined yet that I'm aware of which direction they want to go, whether they want to go medically or they want to go the cash crop. Again, the silver-haired legislation is pushing. Those are the folks that are 55 and older. Simply cash crop, let's get money off of it. The law enforcement folks came out, again, with their opinion, medical person coming out. I think the most important thing is for you to contact, as Kim said, contact your representative. Find out what they know. Who is talking to them? Where are they getting their information? We talked about, again, those studies. What is going to happen? How's it going to be if you do it? Who's going to regulate it? What's it going to do to keep it safe in our communities and out of the hands of our kids?
All right,
And
we all
if
agree with that,
someone
sure.
can benefit from it, that's great. That's not my concern. My concern is, and our concern is when it gets beyond that, helping that one particular person. Now we've got kids having access to it. It's not regular. We've got a pill problem. We got a huge pill problem. We can't fix that. So now we're going to add another thing on top of it. How do we regulate that? Who gets the permit? Who gets the permit to grow it and sell it? You know, those type things. So I think it's very, very important to find out legislative who your delegates are, what are their viewpoints, and certainly let them know how you feel.
Like Tim said, there are tons of resource information over here. There's great tips on preventing drug abuse, talking to your children and adolescents. There's tips for parents. There's also a list of NA and AA meetings that are held throughout Wayne County. Also, the Wayne Family Resource Network